Welcome, everybody. Looks like really just when we think we're getting through this, the virus throws a new curveball at us, the Delta variant, which is renewed the growth of the virus in Colorado. We now have 358 hospitalizations. If you recall, last week we were down around 270, 280, so we've seen really an immediate jump just over the last week. Not nearly as bad as many of the other states yet, but I would say that from all the data we're looking at, we expect it to get worse before it gets better. Of course, the good news is our hospital capacity is not in jeopardy. We don't expect it to be in jeopardy thanks to the 70+% of Coloradans who have gotten vaccinated. In fact, we do have some very good news to share with you today. If we can fix that, that'd be great. Okay. Today we have now reached just over 70% of all eligible Coloradans have gotten vaccinated. Remember, we hit the 70% of adults a couple days ahead of the July 4th. We are now at 72.12% of adults, but we've now made enough progress with 12 to 17-year-olds where we have achieved 70% vaccination rate for the entire eligible population. As Dr. Herlihy will show, what makes an enormous difference here in the course this takes over the next few months is whether we can get to that 80% vaccination level. We're now at 72.12, makes an enormous difference. Hospitalizations are up, and I encourage people to take additional precautions. So if you're around others in a busy place, it's a good idea to wear a mask. But what really most importantly, if you haven't been vaccinated, please get vaccinated. You are putting yourself at great risk to this Delta variant if you're not vaccinated. We continue to really see that this is largely an epidemic of the unvaccinated. There's not zero risk if you're vaccinated, but it is much lower. Even though 70% of adults have been vaccinated, only a small percentage of hospitalizations are vaccinated. The vast majority are unvaccinated. But there's increasing evidence that despite being vaccinated, you can still spread the virus, even though you yourself might not have symptoms. And so you might spread it to others who are unvaccinated, who could then have very severe symptoms. So please get vaccinated. We're all very tired of this virus. We're really in the final phases. Most importantly, we have a highly effective tool to combat it. That's the vaccines, which work against the Delta variant. And for those who haven't been vaccinated, I really encourage you to do so immediately. It's been 8 months since we administered our first dose of the vaccine. Remember how excited we all were when it arrived in Colorado. We're so excited to watch the science borne out, and the level of protection that we thought it would provide is in fact provided. So it's really good news. And I want to make sure that people have the confidence to get vaccinated. Just to put it in perspective, if there's folks out there that are worried about side effects from the vaccine, you're more likely to get struck by lightning than you are to experience serious side effects from the vaccine. And keep in mind the alternative, if you're unvaccinated, it's like in a lightning storm, you're waving around on top of a building holding a metal rod. I mean, you're really putting yourself at risk. So just look at any type of analysis of that, and you'll see it's not even a close call. If you look at the data, you will get vaccinated to protect yourself. It couldn't be more clear. Make a plan to get vaccinated. You can, if you still don't know where to get vaccinated, you can go to covid19.colorado.gov/vaccine. It's very easy. You don't need an appointment. You can walk into your pharmacy at a grocery store or doctor's office to do it. With the Delta variant spreading rapidly, there's a new sense of urgency around vaccination. And many Coloradans are also taking additional precautions and wearing masks around others. And that's really being felt across the entire country, this sense of urgency. We are seeing cases spike in areas with lower vaccination rates than Colorado. But I also want to put this in perspective that Florida, which is one of the epicenters of the new round of infections of COVID, only has a slightly lower vaccination rate than Colorado, a few percentage points lower. This leads us to conclude that unlike the Alpha variant, where we were confident there weren't enough folks that it could catch an exponential curve to grow, the Delta variant likely has enough hosts that it could lead to greater growth in Colorado again until we could achieve a higher level of vaccination. Again, the good news, everybody should know, the vaccinations work against the Delta variant. And for those who do contract COVID who've been vaccinated, the symptoms are much more minor and much more seldom require hospitalization. Based on the CDC's updates, they've recommended mask wearing to protect those, whether you're vaccinated or not, and many Coloradans are choosing to do that when they're shopping. I went grocery shopping the other day and wore a mask. We also want to make sure that we take extraordinary measures to protect those in most vulnerable settings. And we're implementing this in a way where those who are at greater risk from the virus, and remember, those in their 80s and 90s, the vaccine is very effective, but it doesn't have the same level of efficacy it does for people that are younger, and it might not last as long. And there are breakthrough cases, and even milder cases can be major for people with other health issues in their 80s or 90s. So mask wearing is important around our most vulnerable population. And of course, making sure that we get vaccinated first and foremost. Last week, we responded to the Delta variant, and we announced a change for the state of Colorado's employees. It was modeled after the requirement for federal employees. There's a lot of overlap. Effective September 20th, all state employees either need to be vaccinated against COVID, demonstrate that, or they need to be tested for COVID twice a week to help keep it out of the workplace. That's an example of a workplace policy that can help keep people safe. And some people ask, why wait till September 20th? That's because we want to give people the chance to get vaccinated. Many will who haven't yet had it. But also we need to set up testing for those who choose not to, so they can be tested very simply twice a week. And to make verifying your vaccination even easier, we have the My Colorado app, which is available to all Coloradans. You can download their digital vaccine records, and you can demonstrate that if a local concert venue or gym or whatever wants you to show vaccination proof. You're able to do that very simply. Our goal is to really prevent Colorado from going down this path that we're seeing in other states that is spurred by infections of unvaccinated individuals. We want to encourage those who are unvaccinated to get vaccinated. And we also believe, as we always have in layered protections against the variant. So masks are effective. Twice a week testing is effective. All these things are good steps, especially for those who are unvaccinated, to make sure that they are not actively spreading the Delta variant in their workplace. And we, of course, as a state, want to model what a safer, reasonably safe workplace looks like, and many private employers are doing the same thing. And I also want to highlight at this point, over 70% of Coloradans have done the right thing to protect themselves, their families, and our community. It's really time for those who haven't shouldered more of the consequences for the ongoing spread to make sure that they're stepping up too, and the regular testing is a good way to do that. We employ just over 30,000 people across the state, and we want to do our part as a state to help make sure that we can reduce the spread. And as I said, while I fully expect it to get worse before it gets better, we don't yet know the high level of this peak, but with the best way we can reduce that peak is to successfully vaccinate more Coloradans. Just today, the city of Denver took the additional step of requiring vaccines for employees and contractors, and there's many employers, private sector, public sector, some of our universities, that are taking additional steps to increase the vaccination rate to help put the worst behind us. And I certainly applaud these efforts, everything from mask wearing to serial testing to vaccination. Vaccination being by far and away the most effective. Right, and so while the twice a week surveillance will help keep people with COVID out of the workplace that the state is implementing, we're also hopeful that this will be just yet another reminder to people to get vaccinated. We have many resources available to employers in Colorado, including our workplace vaccination program. Yes, that means if you have a company, whether it's 20 people or 200 people, we can literally show up with our bus in your parking lot and make it easy to vaccinate your employees right there. You can go to atworkvaccinations.com if you're an employer, HR professional, and help schedule a vaccination clinic for your office. We are also continuing to see the success of the Walmart gift card program, an average of a 25 person per day increase, about a 39% increase in the gift card period compared to the rest of July. They're going to be at sites around the state. We do focused text-based outreach to people in the vicinity. You can find out more at cocomebackcash.com. We've always been led by the data. I want you to see the same data that I'm seeing. I don't want people to be have their head in the sand with regard to the Delta variant, and I don't want folks to be overly and irrationally alarmist from the Delta variant. The truth is usually somewhere in the middle. The data bears it out. The important thing that people should know is that the vaccine works against the Delta variant, and for those who contract COVID, it is a milder case, whether it's the Alpha or Delta variant. To show the sort of how the Delta variant has taken off and is far more contagious, it's basically supplanted other variants in our state. And as Dr. Hurley will show, nearly all cases of COVID-19 are now the Delta variant in our state, over 80–90%. We are also closely monitoring what Israel is doing with regard to third doses for people over 60. They've started giving a third vaccination dose to everyone over 60 after 5 months. I'm going to continue to urge the FDA to quickly review Pfizer's request to allow for a third dose by cutting red tape. And I'm aware that some Coloradans have already taken matters into their own hands, are getting that third dose. And it's really important that the FDA moved at the speed of the pandemic and meet people where they are at. And I really hope that the FDA can rise to the occasion in this pandemic to help end this pandemic, just as they expeditiously approved the 3 effective vaccines. I also hope that they will be able to give full approval to the vaccines as quickly as possible as well. With that, it's important that we follow the data. We have a lot of new information about the Delta variant. This virus always seems like it's ready to throw us a curveball, and it's throwing us another one, but we're learning more every day. And here to share what we know, don't know, wish we knew, and we'll learn Dr. Rachel Hurley, our state epidemiologist.
Thank you, Governor. Good afternoon. Can you bring up the slides, please? All right, so I want to provide you with an update today on Colorado's trends, talk a little bit about the Delta variant, talk about vaccine breakthrough cases that we're seeing here in the state. But first wanted to start with this figure that shows you a comparison of cases that are occurring in Colorado right now, the rates that we are seeing among the unvaccinated population compared to the fully vaccinated population. Overall in Colorado, the last couple of weeks, we've seen about a 30% week-over-week increase. So we certainly are seeing a pretty rapid increase in cases in the state at this point. Certainly not the same picture that we're seeing in some states across the country right now, but Colorado, like many states, is certainly seeing a pretty dramatic increase in cases. But what I want to point out here is that the increase that we are seeing is largely occurring among unvaccinated individuals. So we really see that unvaccinated individuals are really driving transmission in the state right now. Overall, we see about a 5 to 6 times the rate of infection in unvaccinated individuals compared to fully vaccinated individuals. Next slide, please. And we unfortunately have also just recently started to see an increase in hospitalizations in the state in the last week or so. Very similarly, this figure compared to the last one shows you data for hospitalizations, unlike the last figure which showed case data. So again, we are seeing an increase, and that increase that we are seeing in hospitalizations is largely occurring among unvaccinated individuals. So you can see just a gradual increase that has really occurred since the beginning of July in fully vaccinated individuals, but a much larger increase, of course, occurring among unvaccinated people right now. Next slide. So this is a table that is summarizing the proportion of cases, hospitalizations, and deaths that have occurred among unvaccinated individuals in the state. So you'll see that there's 2 date values here. So you're looking at January 1st through July 24th, and then July 1st through July 24th. And you'll see that we're seeing different proportions here. So if you look all the way back to January, you'll see that 97% of our cases have been among unvaccinated individuals. 96% of our hospitalizations and 97% of our deaths due to COVID. If you look at the data more recently, though, the data since July 1st, you'll see that those percentages are a little bit lower. For cases, it's 80%. For hospitalizations, it increases to 87%. And for deaths, it increases to 92%. I think this also highlights the fact that while we are seeing some breakthrough cases occurring, we know that the vaccine continues to be highly effective at preventing severe disease. As shown in these numbers, we see much greater protection against hospitalization and death. I also want to point out that as time goes on, we do expect these proportions to continue to decrease, and that is simply because we have a larger vaccinated population. So as the vaccinated population in the state continues to grow, we will continue to see this proportion decrease simply as a function of the number of vaccinated people that there are. Next slide. So this figure is showing you trends associated with the variants that we're seeing in the state right now. So you can see the alpha variant shown in blue. So you can see that rapid increase that we saw since January. Since that time, we've really seen a pretty steady decline in the alpha variant, and that alpha variant has been replaced steadily by the delta variant. As the governor mentioned, almost everything that is circulating in the state right now, so 95.5% of the virus that we're sequencing in Colorado right now is the delta variant. So clearly that is what is driving our pandemic right now. Next slide, please. All right, on this next figure, the vertical or y-axis shows the percentage of cases each week that are occurring among fully vaccinated individuals. Each black dot shows you that percentage on a weekly basis as the overall vaccination rate in Colorado has increased. The shaded area between 90 and 95% labels shows you where we would expect those numbers to be for a 90 to 95% effective vaccine. You can see that we were in that range for many weeks until recently. In the last few weeks, the proportion of cases occurring among vaccinated people has grown a little bit more than we've expected and is now closer to that 80% vaccine effectiveness range. The timing of that increase may suggest that it could be linked to Delta, but I would caution that this analysis is a crude estimation of vaccine effectiveness. It is not a controlled study, so it needs to be interpreted carefully. There's a lot more we need to understand about the Delta variant and our immune response to infection and vaccination over time. I also want to be perfectly clear that 80% effectiveness for a vaccine is still a highly effective vaccine. And so we have seen in Colorado with our surveillance data that I'm showing now, a slight decrease in that vaccine effectiveness. But overall, we continue to have highly effective vaccines, and vaccines really continue to be the best strategy to control the pandemic in the state. Next slide. So we've taken a closer look at our vaccine breakthrough data to try and understand where these cases might be coming from. Again, keep in mind that we do expect vaccine breakthrough cases to occur. We know that the vaccines are highly effective, but they are not 100% effective, and so vaccine breakthrough cases are going to be expected. This figure compares age distribution of vaccinated Coloradans in gray to the age distribution of vaccine breakthrough cases in teal. When we see the teal bar exceed the gray bar, that means that age group is seeing more than its expected share of vaccine breakthrough cases. We see fewer than expected vaccine breakthrough cases in children 12 to 17, but more in older age groups. Next slide. This next figure looks at the share of vaccine breakthrough cases by vaccine type. Similar to the last figure, where you see the teal bar exceed the gray bar, that means that vaccine has a greater share of vaccine breakthrough cases. So we are seeing more vaccine breakthrough cases with Janssen or Johnson & Johnson vaccine and the Pfizer vaccine compared to Moderna. Next slide, please. Finally, this last figure combines age group and vaccine data. Across age groups, we see more vaccine breakthrough with Janssen and Johnson & Johnson and Pfizer and less with Moderna. This is something that we want to investigate further. I think I want to first point out that we're not surprised to see more vaccine breakthrough disease occurring with the Janssen or Johnson & Johnson vaccine because we've known from the beginning that that vaccine was slightly less effective than the mRNA-based vaccines, Moderna and Pfizer. So this is, again, something we're investigating further. We know about the Delta variant. But of course, we want you to have the information that we are seeing and have this information to make decisions for yourself and your family. Thank you. Oh, one more slide, sorry, last slide. Finally, I wanted to end here with So by increasing vaccination rates to 80%, we can dramatically decrease the number of hospitalizations that could occur in Colorado going into the fall. Thank you.
So bottom line, don't ignore all this. Don't panic. If you haven't get vaccinated, get vaccinated. If you are vaccinated, be safe, be smart, and let's get through this. Happy to take some questions.
When you look at county by county information, it seems like the biggest problem continues to be vaccination rates outside of the greater Denver metro area and in rural Colorado. What are you doing to encourage those folks? I mean, Crowley County is like 13% or 19%. I mean, these rural counties are just not doing it. What do you have in your toolbox to encourage people in those communities to get vaccinated?
Yeah, so we didn't bring it out of this press conference, but you've seen before. The hospitalizations plotted with the vaccination rate, and there's a national version of this chart as well. It's not a shocker to anybody, but areas with lower vaccination rates in our state and nationally have higher hospitalization rates, and it's a very strong correlation. Areas with higher vaccination rates have lower hospitalizations. And you're right, there are parts of our state that have lower vaccination rates, and sure enough, unfortunately, they have higher cases, higher hospitalization rates. So our outreach with our state bus program has been focused in many of the areas with the lowest vaccination rate. We have one bus that is in Mesa County full-time. Others continue to travel the state. Our text-based outreach with regard to the incentives and the large sites. And of course, most importantly, working with our local partners. I've convened, we've talked to, just last week, we had a conference with many of the commissioners and public health entities from the counties with a lower vaccination rate. And we asked for their help because they, in many ways, are part of community, know how to reach their population in a bottom-up way rather than a top-down way. And that includes really activating local networks of trusted individuals, could be doctors, faith leaders, migrant leaders in communities that have large migrant worker populations, to really make sure that people are able to get their information from a trusted source and increasingly make the choice to get vaccinated.
Señor Gobernador, recibimos una denuncia de un centro de vacunación en el cual hubo al menos 2 personas que intentaron vacunarse, que ya habían sido vacunados, detectaron y no se produjo la vacunación, pero las personas fueron por ganar el incentivo de los $100. ¿Cuál es el consejo que usted le da a esas personas sobre ese incentivo y evitar el riesgo?
Las personas pueden recibir $100 por la primera y también cuando reciben la segunda dosis, o sea, un total de $200. Es importante mencionar que cuando una persona se vacuna, ellos tienen que firmar una forma que dice que esta es su segunda o primera dosis y no más dosis aparte de eso.
Governor, this is a question I think for both of you. With kids going back to school, what's your best advice for parents? How should they be looking at this? A lot of them are trying to decide what to do with their kids, and also with those breakthrough numbers, how does that inform your guidance?
I'll Dr. Hurley address that.
Yes, so I think the first thing I want to emphasize is that the vaccines continue to be highly effective and really continue to be our best strategy. You know, it's really in Colorado right now among our unvaccinated population where we need to see action, right? So that is the population that we need to see vaccinated. It's the population that we need to see wearing masks. It's the population that we need to see regularly tested. And so I think really the bulk of action really falls to that unvaccinated population right now.
Sabemos que hoy la ciudad de Denver hizo el anuncio de que tienen los empleados en lugares de riesgo hasta el 30 de septiembre para vacunarse. ¿Usted aconsejaría a otras ciudades seguir ese ejemplo y tener mandatos similares? Y la siguiente pregunta es, aunque esto solamente aplica para empleados de la ciudad y personas que trabajan en lugares de riesgo, ¿qué estrategias planean ustedes usar para motivar al resto de la comunidad que no se ha vacunado?
Sí. Para los empleados del Estado, preguntaste. del Estado, ellos necesitan mostrar que recibieron la vacuna o necesitan tener 2 pruebas de COVID cada semana. Es gratis y es fácil, pero es mejor si el vacuno efectivo seguro. Es importante mencionar que las personas que no están vacunadas deberán seguir usando una tapabocas para proteger a las personas a su alrededor.
First one's for both of you. Do you recommend that folks avoid large indoor gathering places where people are tightly packed, for instance, like bars or nightclubs, maybe an office building? And then I wonder, Governor, if you can address how you think this recent spike in cases and hospitalizations is going to affect the state's economic recovery, if this is going to put a pause on things, if you're concerned about the direction from that standpoint.
Yeah, I'll just address the second one, and I'll let Dr. Hurley address the medical one. No, I think that I don't see a scenario where we're likely to exceed our hospital capacity. You saw the projections. It will likely get worse before it gets better. And if we can't achieve 80% vaccination rates, it'll get worse as it was a few months ago. We could be up 700, 800, 900 hospitalizations. If we could get more people vaccinated, we're hoping it tops out at a lower number. I think that hopefully this won't, we have one of the lower rates nationally, so I don't think it's discouraging tourism. We actually, when we've been at all different points in this pandemic, sometimes higher, sometimes lower. When we're at a lower point, we usually have the contrary concern. We're worried that then people from Florida and Alabama will increase the infection rate here. But it already is endemic here, so we really can't create an environment that allows it to spread. So, I think that this is tough to face another peak when we thought that the last peak was behind us. But I'm optimistic and hopeful that this peak will not be as large as the prior peak. And we do have the ability to reduce the height of that peak by simply getting vaccinated. But our hospitals are in good shape operationally. There's enough testing. The vaccine's very easy to get. We have all the tools we need to end this pandemic. Employers are stepping up and taking safety precautions that they need to. So as I said, it's not a time for alarm, but it's also not a time for putting our heads in the sand. We need to use the science to really guide a response that meets the needs of where we are. Dr. Hurley?
Yes. So as rates increase, we certainly are going to see increased risk associated with individuals attending large gatherings. That, of course, is going to be higher risk if those gatherings or events are in indoor environments. But thankfully, we've learned a lot about how to decrease risk. And so obviously, the best way to do that is vaccination. So your risk of attending an event like that is going to be much lower if you are fully vaccinated. And then, of course, there's masks as well. Certainly critically important for individuals that might be attending larger events, especially indoor events, to wear masks. But for individuals that are fully vaccinated and want to decrease their risk, mask wearing is certainly a good way to do that. And I think individuals need to sort of look at their own individual risk profile, understand what health risks they might have that could be associated with a vaccine breakthrough infection, what risk those around them might have if they're caring for a senior, a loved one that might be at higher risk, or if they have unvaccinated children at home. So I think those are some considerations. But thankfully, we have many more tools available to us now. Of course, the vaccine first to decrease that risk.
Let me just add the importance of getting tested, especially as people are, joining each other indoors and doing events and all those sorts of things again. There's more of the sort of the common cold and regular symptoms going around. So I hear from so many people, I got sick. Get tested, because you want to know earlier rather than later whether it's COVID. It's easy to get tested. You can do it at your local doctor, pharmacy, hospital, many places at testing sites. In many cases, it is just a common cold, because that is going to be going around more now that people are out and about and the symptoms are minor. But please, if you're experiencing symptoms, get tested so that you can alert those around you if in fact it is COVID-19.
Governor John Frank here. Two-part question for you. How worried are you about the winter coming, the weather turning colder and the transmission of the disease? And secondly, how often and in what circumstances are you wearing a mask these days?
Well, look, you said, how worried am I about winter coming? I couldn't help but harken back to Game of Thrones when winter meant that the zombie hordes from the north were invading. I'm not quite at that level of fear. And I'm also hopeful that we'll achieve a higher level of vaccination by winter. And that's important. You saw the chart that Dr. Hurley he shared that showed this simple difference between 70 and 80%. We're now at 72% of adults. It makes a big difference. And this peak is much smaller and ends before winter, as long as we can continue our progress on vaccinations and achieve a reasonable goal of 80% vaccinated by winter. So I'm hopeful for that. I'm also hopeful the FDA will move expeditiously on a third booster shot for those who want it, especially our most vulnerable, which could significantly bring down fatalities. I'm hopeful for the vaccine being improved for kids aged 5 to 11. My kids in that age group very much look forward to getting it the moment it becomes available. I now wear a mask when I'm around others as a courtesy indoors in large groups. Again, I generally do it as a courtesy. If a policy of a store or a business I'm in requires it, I certainly follow that policy. Otherwise, if I'm going to be around a lot of others, if they want that peace of mind that me wearing a mask and others wearing a mask provide, I'm certainly more than happy to oblige. I don't wear them around outdoors, in other places that aren't crowded. You'll probably see me coming into press conferences wearing a mask. We have a number of folks down here in person. We hope to see you in person, John, sometime, and you're welcome to wear a mask or not. Looking around this room, it looks like most people are wearing masks. There's a few that aren't, but again, I think it's good to model as somebody who cares about other people. If they're going to be in a position where people could be at risk and it's a large group, it's a good thing to wear a mask, and I'm happy to model that when I can.
Hi, Governor. It's Jessica Seaman with the Denver Post. You've mentioned Coloradans should wear a mask. Or is the state going to officially recommend that vaccinated people wear masks indoors as it has with the school guidance? And why not do a mandate?
Well, the CDC recommends that people wear masks. I think that one of the things that was hard to get at with the change in federal policy, because remember the CDC always said unvaccinated should wear masks, but then there was sort of a presumption of vaccination, and it turned out that really hardly anybody wore a mask, and probably least of all those that were unvaccinated, because they probably weren't those that were listening to the CDC. So if we all were to, honor the honor system and follow it, I think it would be great if the unvaccinated wore masks. But because they're not easily distinguishable, there's many of us who are vaccinated that from time to time are also wearing a mask to protect others. I think that those who are vaccinated are feeling are feeling increasingly, upset with those who are not taking the steps that they need to end the pandemic. And so that's why many that are vaccinated are once again putting their masks on to protect those who haven't yet had the chance to be vaccinated.
Governor, this is Vinny Belgiudice of Bloomberg News in Denver. 2 questions. Number one, I just want to make sure I understand this. Denver's requiring its employees to get vaccinated. Colorado, as of your announcement Friday, is going to be testing. The second question is the vulnerability of preschoolers and toddlers to the Delta variant as they are unvaccinated. How dangerous is the outlook for little kids because there's no vaccination and the Delta virus is so much more aggressive? Thank you very much.
So, the disease is to be taken seriously for all age groups, but it's not as clinically dangerous for younger people. Doesn't mean that it's a good thing to get. Just like any disease, it's better to avoid it. But the risk profile is much less for younger folks than it is for folks my age, and it's better for folks my age than it is for folks in their 70s or 80s or 90s. I haven't had the chance to review exactly what Denver did yet. I think they just made the announcement an hour ago. But generally, many employers, including the city of Denver, private employers like Google, many others, are stepping up to take steps to increase the vaccination rates in the workplace. Our state has also done that in a way that's appropriate with our corporate culture as a state that values our employees. And we've done that by saying that for those who are not vaccinated, you will have to be tested twice a week to help keep our workplaces safe and do our part as a model employer to prevent this spread. There could very well be those that have been putting it off who choose to get vaccinated because they don't want to go through the additional steps of having to wear masks or being tested regularly, but that will be a choice that people will have. So different employers, public and private, cities and counties, private businesses, are taking various steps with the same goal, and that goal is increasing the vaccination rate, ending the pandemic, in addition, adding an additional level of protection to their own workplace to protect their team members.
Hey, Governor, this is Gabrielle from Fox 31. Two quick questions for you. So earlier you mentioned that you know of Coloradans who've gotten an extra third shot already. Do we know how many Coloradans have done that?
Well, we wouldn't really know because they would likely do so with a different name or a different address because most providers would not administer it if it showed up in the system as a third dose. So other than anecdotally, we don't have any information about that, but we certainly are aware that many Coloradans, particularly most vulnerable Coloradans, are perhaps a little bit ahead of the FDA and want to get that booster shot immediately.
Governor Charles Ashby from the Grand Junction Daily Sentinel. So your statewide order for state workers apparently does not include county workers, and I'm wondering why not? Are you allowing the counties to make that decision? Are you encouraging them to make that decision? And I do have a follow-up for Dr. Hurley, if I may.
Counties are political subdivisions of the state, but we truly have a great degree of trust in our local administrators of state government services, namely our county government. And some counties, like the City and County of Denver, are putting requirements above and beyond the state requirements. There are likely other counties that might have their own appropriate COVID control measures that they implement at their county level. So we really embrace our commissioners, our local public health departments as important partners in using local authority in the best possible way to increase the vaccination rate and protect our workforce. What was your second question, Charles?
Yeah, just to follow up for Dr. Hurley, on the third vaccine, the COVID shot. I know the CDC is saying you don't need one, but given what you said about the 80% effectiveness and given what you said about that this is all about the unvaccinated, I'm wondering what the vaccinated can do more to protect themselves beyond the obvious of wearing masks and that sort of thing. And shouldn't the state say, go ahead and get a third shot?
So a couple of things. I think as far as what the vaccinated can do, I think certainly encouraging your unvaccinated family members and neighbors to get vaccinated is an important step that you can take as a vaccinated individual. We want really individuals to feel comfortable, to have access to the data and the science, and sharing the information that you use to make that decision for yourself is really helpful. As far as a third dose and whether a booster dose is needed at this time. As the governor said, we really need FDA to make that decision. They're looking at the data and the science around safety and effectiveness. And as the governor said, we really want them to expedite that review and get us to a place where we have an understanding and have a recommendation about a potential booster dose.
Hi, Governor. Jason Gonzalez with Chalkbeat, Colorado. I want to know, what do you expect the impact of the Delta variant and rising cases to be on the school year this year?
Well, I expect that every district in Colorado will be back in person for in-person instruction. Will minimize disruptions to the schedule from in-person instruction. Some will be using quarantine protocols that may necessitate brief interferences with in-person instruction to protect schools from larger outbreaks. But by and large, we expect that every district will be back, every classroom will be back, every kid will have the opportunity to send school in person, minimize interruptions, and we are working closely with all of our school districts to implement layered protocols to keep schools reasonably safe during the pandemic. And in different areas, that means things like symptom checking or masks or making sure staff is vaccinated, ventilation, a number of different techniques that are included in both the CDC guidance and in the guidance that we've made available to school districts.
Governor Dave Perry from the Sentinel, Colorado here. I'm going to follow up on Jessica's question from the Post. With the science being so clear on the efficacy of wearing masks, especially in light of the bulk of the transmission of the virus now coming from unvaccinated people, and masks being especially effective for unvaccinated people to wear to mitigate the transmission. What's the argument against a statewide mask mandate right now for inside?
Well, a statewide mask requirement would be a extraordinary step. It was one that we didn't hesitate to take when our hospital capacity was in jeopardy, and that we sought to remove the minute we reached a conclusion that our hospital capacity was no longer in jeopardy. It's not the type of step that is normally appropriate in non-emergency circumstances. So masks also are not nearly as effective as vaccinations. And there are scenarios where there's a trade-off between masks and vaccinations. And we don't want people, for instance, thinking, I don't need to get vaccinated because I wear a mask. We also have, there's many employers in our state and also businesses that say, if you are vaccinated, you don't need a mask. And so that can be another reason to get vaccinated. And we don't want mask wearing to be an excuse not to get vaccinated. We see that masks are probably effective somewhere in the 50% range at reducing transmission. The vaccine is north of 80% effective in reducing transmission, but even more importantly, reduces the severity of the case that ensues if you're vaccinated. A mask does not reduce the severity of the case if you contract COVID. It reduces your likelihood of getting it a bit, not as much as the vaccine, but if you do get it, your case is every bit as bad. So please get vaccinated. That's the top thing, the most important thing. Wear masks around others is a great sign to show that you respect others and that you care for others.
Hey, Governor, this is Gabrielle from Fox 31 again. So you mentioned earlier about the 39% increase that we saw during this gift card period, but vaccinations are going up nationally. They seemingly plateaued here. So why have vaccines kind of stalled here when it comes to distribution? And what will we do to encourage vaccinations after these gift cards run out?
Well, they've increased here, as I said, the last few weeks. What at some level, you start running out of people. We're certainly not there yet. We're at 72% of adults, just over 70% at 12 and up. As you get up towards 80%, you start encountering folks who just don't want to get the vaccine. So we're not there yet. Plenty of folks that are willing to get it, open to getting it, and we need to connect the dots. As I indicated when we achieved the milestone of 70% of adults vaccinated by July 4th, I said it's going to be harder to go from 70 to 80% than it was from 0 to 70%. And that remains true today. And we're committed to doing the hard work to help Colorado achieve 80% protection through the safe, effective vaccine.
Governor, you were talking about what would be required of state workers by September 20th. I think you said they'd have to demonstrate they're vaccinated. How would they do that, and would you accept an affidavit like what the feds are doing?
We'll be working on the implementation policies, and I expect that we'll track fairly closely to the federal government, but we'll be developing the HR protocols around that in the coming weeks.
Yeah, Governor, where do you have to get to in order to impose another emergency declaration? I realize it's only been a month since you canceled the last one, but how close are we to that?
You know, our North Star from the very start has been to avoid overwhelming the ability of our hospitals and doctors and medical system to provide the very best quality of care to Coloradans in need. Whether you have a heart attack, cancer, stroke, appendicitis, we want to make sure that you have every chance of getting better, or COVID, and there's much better therapies for COVID than there was. And that is not at risk with the current level of COVID hospitalization. As I said, I expect it to get worse before it gets better. But certainly we will continue to monitor that, and I want to, of course, continue to reassure the people of Colorado that we are going to take whatever steps we need to make sure that you can get the best quality of medical care if and when you need it. But I'm not greatly concerned about that now. It's not a time to be alarmist. It's also not a time to stick your head in the sand. It's a time to be thoughtful. If you haven't been vaccinated, get vaccinated. And as a courtesy and to protect yourself, wear a mask when you're indoors around many others.
Governor and Dr. Hurley, I wonder if you guys have a sense of the overall population that's vaccinated. I know more than 70% of the eligible population is vaccinated, but there's, obviously a lot of children who can't get it. Do you have that percentage by any chance?
We have that number. I don't have it at the top of my head, but we can easily get that to you. No problem. We just reached 70% of 12 and up. That's the new threshold. But now you're going to add in 11 and under, and will be lower again. But we have that number. We generate it as well, and we're happy to get you that specific number. Thank you, everybody.